And at 8:36 now from 1490 KBZY, we welcome in studio Dr. Ted Rothstein. And Doctor, good to have you in studio with us here.
Hey, thanks, Bob. It was a nice ride up from Portland, and I really enjoyed it. Beautiful weather.
Yeah, absolutely terrific. Now your doctorate's kind of in an interesting area. Maybe you could explain that as a way to enter into the conversation today.
Happy right now, if you like.
Sure.
Yeah, my doctorate is in physical anthropology, and I studied growth and development of the teeth, face, and jaws. Because the University of Pennsylvania has an orthodontic department, and they needed information to begin treatment of the kids. They want to know if the problem was about straight teeth or was it about bones that were deformed. So my study was about the study of deviation. Is something so deviant that it's another problem?
Mm-hmm. Now, how did that lead eventually to your interest in weight loss?
Completely different. I was an orthodontist. One day, a lady from California, a young woman came from California, and she said, "Would you take my braces off?" I said, "Sure, no problem." And then, but at the end of the conversation, she said, "Hey, maybe you would wire my jaws for weight loss." I said, "Sure, but I don't know anything about it." Oh, she says, "Everybody in California, all the guys, all the dental professionals do it." So I said, "Okay, just give me an idea how they do it." "Oh, well, they put braces on the teeth, on the upper and lower teeth, and then they wire the jaws in a certain way." Well, I did it for her. Later, it turned out she was lying. She never had anybody. They don't do it at all.
Oh.
I'm still trying to convince them that this is a service. This is a dental service that dental professionals should be providing in their office. We are in an epidemic of obesity and all the ill health related concerns that come about with it, and we should do something about it. We are the guardians of the mouth.
Well, so she fibbed a little bit, said everybody in California is doing it, but you didn't know that at the time. But then, how did you proceed to develop actually your own technique?
It's taken 20 years, actually, of development, because it's not only a matter of a device putting braces on teeth, or at least on the eye teeth and the teeth behind it, but it's an idea of how long do you keep it on? What's going to happen to the teeth and the gums and the jaw joints? And that took time to develop. I had to do a research study. I had to gather up 100 patients and ask them 100 questions. What do they think of this method of weight control? Did it work for them? And what I got back was the end result was 4 very important things. Is it safe? Is it effective? Does the general public accept it? Weight control by a dental professional. And the answer was, yes, it's safe. Yes, it was effective. On average, they lost about 30 pounds every 3 months, and no harm ever came. The protocol calls for a very specific kind of very gentle wiring that prevents the jaw from opening more than the normal position that it's always in. You're in the position right now. Our listeners, they're in the position right now. To get to the position, all they have to do is say, "Mama," and they're in the position. Say, "Mama," note where your teeth are. They're about 1/4 of an inch apart. That's where your teeth are wired to. The wire does not hold your jaw. It just prevents it from going any further. And as a result, you must be on a liquid diet. You cannot eat the solid foods. You cannot eat junk foods. You cannot eat comfort foods. You cannot eat foods, all the bad foods that you know about. French fries, cheeseburgers, ice cream, candy, cakes. All those things are off your list. You cannot eat them. Of course, you could take the wires off if you wanted to, and then you could, blend your hamburger if you wanted to, but, who would do that?
So what does the OJW weight control, what does the OJW stand for then?
Orthodontic jaw wiring. And the orthodontic has to do because of the fact that brackets, you need to wire around something. So that's one of my contributions. I invented the idea because I was an orthodontist. I said, okay, let's do it with brackets that have little hooks on them, so that the hooks enabled me to gently wire the jaws into this position, which I will refer to as mama. You say mama, you're in the position.
Mm-hmm.
And that's where you stay. The protocol calls for you to be wired into that position for 5 weeks, and then at the end of the 5 weeks, you become unwired, or the dentist will unwire you. But it's very simple to cut out the wire. So you're unwired for 5 days to relax the jaws and have complete and normal movement of your jaw and the jaw joint. And then at the end of the 5 days, if your jaw joint is nice and comfortable and you're feeling happy, you come back to me, I rewire you, or if you want, I teach you how to do the wiring yourself. It's easy. If you go to the website, my website, it's a dedicated website, OJW for weight control, OJW for weight control. If you go to the site, you can see movies, how it's done, how the braces are applied. It's all very gentle, no pain, no discomfort ever. You can speak normally. I'm speaking to you as though my jaws were wired right now. Just keep your teeth near one another and talk a little bit more with your lips. And that's the position. You don't have to drink through a straw. You can just drink normally. Put the glass up to your lips and drink. You're on a liquid diet. 5 weeks wired, 5 days unwired, low calorie, liquid diet between 900 and 1,200 calories, and you will lose approximately 30 pounds every 3 months. It's not meant to be a drastic method, but the people who would choose this method would definitely not choose surgery, which has a mortality rate to it, and they would not choose medications because, the crazy side effects, you have no idea what the medications do. And if you're a woman of childbearing age, you certainly want to think about the medicines that you are going to put into your body to lose weight, because those medications go everywhere.
Now, you've generated quite a bit of interest. You were asked to speak back east, as we say recently. Maybe you could talk about that.
Sure. I was invited to speak at a nutrition conference last year, July 28th, in Rome. It was a long trip by myself, but yes, I went there and they appreciated it. They made me a keynote speaker. I don't know why, but I became a keynote speaker. And as a result of that, one of the interesting side effects of speaking in a conference series is that other groups want you. So I have been called upon, asked or requested to speak at other groups, and by and large they don't quite fit. So I have to refuse them. This group that I spoke to just in Philadelphia a few days ago, they made me a keynote speaker, and they said, "We like you. Come back to New York. You can play out in New York and give your conference, no registration fee," which I thought was really cool. So yes, I enjoyed speaking, and it gave me an opportunity. Every time I speak, I get a little bit better and a little bit more comfortable. So I feel very comfortable speaking to Bob and to you, my audience out there. I just like it's just nice. It's just become easier and easier to speak and tell you. It's because I'm so familiar with my topic, as any specialist would be. So orthodontics, I was an orthodontist for 40 years, and when I came to Oregon 2 years ago, I decided I am going to continue doing this passion of mine. And in fact, when I use the word passion, it makes me think I only choose patients who I am quite sure are dedicated and passionate, who are willing to choose a goal weight and really, really want to reach that goal weight. So before I choose anybody, I'm very careful. I give you, forms to complete. Not very many, but they're very significant forms. Indeed, an interesting thing you might not realize is dental professionals are not permitted to diagnose obesity. So one document that you must give me is a very brief note from your physician that says, you may go on a low-calorie liquid diet. And once you give me that, I am permitted to fit an orthodontic jaw wiring for weight control appliance, and it's very simple. It takes 15 minutes to put on, to put on the braces or the brackets, I call them, and then 15 more minutes to do the wiring, and then it takes about 45 minutes to teach you how to do the wiring, but you don't have to learn. If you say, look, no problem, I can get back to the office every 5 weeks, no problem, then I'll just rewire you, re-examine you, which I do initially anyway. It's just as though you were an orthodontic patient, a complete, thorough, complete examination, and including a panoramic X-ray. I want to know everything about your mouth. I also want to know if you're getting psychiatric or psychotherapeutic counseling, because that's very important. Because many of the people who come are depressed and they're anxious. They can't. They're out of control. They have what I call CED, compulsive emotional eating disorder. They eat mindlessly. They go to the pantry. They go to the refrigerator. They go in because that's the destination when they're anxious. When they need a break. It's just an easy pathway to go eat. So OJW just stops that. It banishes all the flimsy excuses you use to go eat.
Yeah. Now, the appearance would be somebody might just think you wear braces. Would that be how it would appear to somebody?
Well, no. You actually. I would say, most people can't tell, but those people, when it is apparent to other people, and you're asked, I always tell people, just tell them that you have a TMJ, jaw joint problem, and that your jaw has to be at rest. In fact, my jaw wiring is also used for that problem. Some people need to have their jaws at rest. They are not permitted to open their jaw wide lest they harm their joint. But in dentistry, the purpose of my weight control device and protocol is to help people with sleep apnea. So all dentists currently treat obstructive sleep apnea or snoring. Just call it snoring. They treat the symptoms. Sleep apnea, snoring is a symptom. So. And the cause of sleep apnea is almost always related to being overweight, obese, and so the thrust of my work is to advise dental professionals. He says, don't treat the symptoms, treat the cause of the snoring. So that's its principal application in dentistry. Also, by eating bad foods, you're encouraging, being obese has a relationship to gum disease. It also has a relationship to caries. You eat junk food, you have caries. You know how expensive dentistry is. So if you can get your weight down, you're aiming at good health, better health. And you're thinking about the future and the longevity and diminishing diabetes, type 2 diabetes, and diminishing hypertension and a whole host of other problems, pathologies that accompany being overweight. One that actually occurred to me, I never even thought of. I said, it's the fact that your knees and your hips have to support all that extra weight, and guess what? You get pathologies of the articulations, and you see people. Just look out at people walking on the street with canes, and you'll see a lot of them, or many of them, are carrying around 50 to 150 pounds of weight that their body cannot support. And they are suffering from it. They don't even realize it. And So losing weight is very important, and especially my method especially is aimed at people who eat compulsively, who have CED, which is an acronym that I created to describe the condition that I aim to treat.
Mm-hmm.
I am not interested in curing sleep apnea because I am not an orthodontist anymore. I only practice weight control, and I don't have a very big practice, and I don't want a very big practice. I just want to treat a few people who are dedicated and passionate, who have a goal, or who will reach that goal and maintain it. That's very important. Change your lifestyle. So this is a method that kind of gives you an opportunity to change your lifestyle. You break that feeling of being out of control, and you get depressed from that. So sometimes the problem is really complex, and you need to have a dietitian to help you maintain a good low-calorie diet, and sometimes you need, or you're already engaged with a psychotherapeutic counselor who is helping you with the depression and anxiety that accompanies being overweight. Being overweight is very problematical. It's the tall guy that gets the job. It's the tall girl. It's the tall thin girl that gets the job. So you're somewhat at a disadvantage. Unfortunately, or I don't know, fortunately, in our culture, being thin is advantageous to your life, and overweight is a great disadvantage in employment, in social matters. People are, people look and they look at people who are overweight, and they're kind of condemnatory. They say, "Oh, these people have no self-control." But my method recognizes that compulsive overeating is really ingrained. It's so hard. You're trying so hard, and to have a doctor, a physician, simply tell you, "Oh, you're just being lazy. All you have to do is exercise and eat less." That is BS. That's not true. For some people, it is so difficult. It's so ingrained. You need all the help and encouragement you can get. OJW is designed for those people. If you're not one of those people, you're not a good patient for me. Dedication, passion, low-calorie, liquid diet, 5 weeks wired, 5 days unwired, then rewire, and continue every 3 months. In theory, you should lose 30 pounds if you stick to the protocol. And if you don't, then you'll fail. But nobody ever blames me, because my job is only to fit you with an appliance and keep your teeth and your gums and your jaw joint healthy. It's you who have to work at the low-calorie liquid diet. And if you do, you'll be successful. When you're finished, when you maintain your weight, I take the appliance off, just like taking braces off. 12 braces, 12 seconds, and then another 5 minutes to clean the leftover glue off your teeth. It's simple, and it's no pain, And
now, one thing characteristic, I guess, of some weight loss programs is that there's kind of an up and down cycle to it. So your patient's been successful in keeping the weight off.
totally, it's a whole area of expertise that's required. In the end, what I do is I have a list of 1,000 ways. A document. It's called 1,000 Ways to keep to maintain the weight that you've lost. But it's just hard. All methods. There is no method, not even surgery. There's no method that is not fallible in that way. Regaining weight seems to be inherent, and it takes will and power and determination to maintain what you achieve that I provide for you.
Mm-hmm. Now, how much of a track record are you basing this on so far? How many patients?
That's a good question. somewhere between 200 and 250 over the course of maybe 18 years of providing the service. I provided it back in Brooklyn, where I was an orthodontist. Remember, I'm not an orthodontist, so, and I still go back to Brooklyn to provide that service. Every 6 weeks I fly back. Of course, I'm lucky. I have my children there, my grandchildren there, and it gives me a purpose in life.
Well, what would you recommend for folks that are interested in finding out more? What's the best way to do it?
Well, I guess I could give you there's 3 things that I would like you to have. One is the dedicated website. It is OJW4WadeControl.com. OJW4WadeControl. My telephone number is 718-808-2656. 718-808-2656. And my email is drted35@gmail. That's drted35@gmail. And that's how you can contact me. And then, but go to the website. You'll see what it's really all about. To start with me, you must provide me with 3 forms: the medical dental history form, the informed consent, the kind of document you sign that you understand the benefits and the pros and the cons of accepting the service. And one more document that I created. It's a list of about 50 items that I ask you to check off to see which ones apply to you. They're kind of like a self-evaluation, self-assessment, so that you can see whether OJW is for you. It's not for everybody. It's not for everybody. So there's this document which I created. I kind of, Bob, if you give me, just read a few, just a few on them, just random, like I ask you to check off. You refuse to weigh yourself. You feel overweight. Your kid said you look the F word. That's fat. Sorry. Summer is getting closer. Your clothes have become ill-fitting. You can't afford new clothes. You look with envy at thin people passing by you. You're eating when you're not hungry. You're eating compulsively. You think you have CED, compulsive emotional eating disorder. You have a sweet tooth. You would never consider surgery. So you have to check off my list, and then you get to realize who you are, what you are, and if the method fits, then you'll accept me. You'll accept the treatment plan. You'll accept it. I'm here up here in Salem. As a matter of fact, I'm about a mile away from the studio. Leffel Boulevard. I'm not familiar with the place, but Leffel Boulevard. Mm-hmm. That's quite nearby, and I come up here by appointment and try to not be here much more often than every 6 weeks or so.
Mm-hmm. And folks actually can go and see your presentation that you mentioned a few days ago in Philadelphia. Oh,
please do. I made a video of the entire presentation. So if you go to YouTube and look up Ted Rothstein DDS, you'll see OJW Weight Control, Philadelphia, June 6th. It's nice. It was fun doing.
Dr. Ted Rothstein, thanks for coming in.
Bob, it was pleasure. and thank you for taking the time to listen to me, audience out there. Okay? Have a great day, a really great day. Bye.
9 o'clock, we're making way for your news with ABC coming up right after this message.